Before we get started, some quick facts about schizophrenia. Schizophrenia is a chronic psychotic disorder that involves the disconnection between an individual's thoughts and language, also called splitting of the mind, not to be confused with split personality disorder. Schizophrenia refers to splitting of the mind as the separation from reality and fantasy, not personality from personality. It affects the person's thoughts, feelings, and behaviors when reacting with incoming stimuli. The onset for males is 10 to 25 years of age. The onset for females is 25 to 35 years of age. And it affects approximately 1% of the population. So as far as the exact cause of schizophrenia, no one knows, but what we do know is that it's caused by brain abnormalities that occur in early postnatal and prenatal stages of life. So basically, when you're a baby. Yay. Some of the abnormalities that occur are enlargement of the third and lateral ventricles, decreased metabolic activity in the thalamus and the hippocampus, and decreased activity and size in the frontal cortex of the brain. Another marked thing that scientists have observed is the increase of dopamine receptors and dopamine activity in the brain. So this is what a normal brain would look like, hypothetically. And here is a schizophrenic brain. It's caused by not an increase in dopamine itself, but an increase in dopamine receptors. In schizophrenic brains, there's also a malfunction with the N-methyl D-aspartate receptor, which helps circulate serotonin and glutamate. This imbalance in chemicals explains why positive symptoms occur, but doesn't account for negative symptoms, which you will learn about in this next section.
So Jeremy is a 17-year-old male. He's born in January. He has an early history of attentional deficit disorder. His grades have recently dropped in school, so his mother has brought him into a school counselor to talk about her son. She claims that he's hearing things that she does not and that he is hearing voices. He denies any occurrence of this happening. Researchers still don't know exactly what causes schizophrenia. It's also still premature to label schizophrenia as either a neurodevelopmental impairment in growth of the development of the brain or a neurodegenerative progressive loss of structure and function of the neurons in the brain. Some risk factors of schizophrenia. Having a close relative with schizotypal personality disorder or schizophrenia, having a winter-spring birth date, having second trimester prenatal influenza infection as a mother, early history of attentional deficits. There are 3 symptoms in schizophrenia: positive, negative, and cognitive. Positive include delusions, hallucinations, most common are hearing voices, alteration in speech patterns, or an extreme enhancement of senses, making colors really bright, sharp, and making sounds louder. Some negative symptoms include the absence of normal social or interpersonal behaviors. People speak very little, have lack of motivation or pleasure in life, lack of interest or enthusiasm, reduced sense of pain. Cognitive symptoms involves thought disorders and overlaps the categories of both positive and negative symptoms. Schizophrenia is further divided into the subtypes paranoid, disorganized, and catatonic based on the presentation of behaviors and dominance of a particular symptom.
Schizophrenia's effect on homeostasis. In the second trimester, migration of brain cells peak and neuroconnections must be made in order to communicate properly. Schizophrenia is thought to interfere with the genetic programming from something such as a prenatal infection, causing neuroconnections to not be properly made. In a healthy brain, neuroconnections are being made all over the brain. In a schizophrenia brain, it is thought that neuroconnections are not being made. Schizophrenia's effect on protein. Neurons carry out an electrical message and release neurotransmitters across the synapse and enter into the next neuron via protein receptors. Hyperdopamine. This is when there is an alteration in the protein dopamine 2 receptor. This allows too much of the neurotransmitter dopamine into the cell, causing positive symptoms such as hallucinations and delusions. Hypodopamine. This is when there is an alteration in the protein dopamine 1 receptor. This doesn't let in enough dopamine into the cell, which results in negative symptoms such as lack of social behaviors. The effect on the neurotransmitter glutamate. This is when there is an alteration in the protein NMDA receptor. This doesn't allow enough glutamate into the cell, causing a deficiency in glutamate, which results in learning and memory problems. Schizophrenia's effect on the cell membrane. The altered protein receptors for neurotransmitters are embedded in the cell membrane.